Founded in 1980, Houston-Hospice has evolved from an alternative grassroots concept to a leader in hospice care. That first year, 65 patients and families received hospice care because 2 women felt it was important for individuals to have dignity and peace at the end of life. As Houston's oldest, largest independent hospice, our mission is to provide uncompromising, compassionate, end-of-life care to patients and families. We serve terminally ill patients from all socioeconomic groups, irrespective of a person's ethnicity, beliefs, or ability to pay, with 5 to 7% of our patients receiving charity care. Our mission is to provide uncompromising, compassionate, end-of-life care to patients and their families in our community. To meet their needs and desires, Houston-Hospice is expanding its inpatient care. It's anticipated that the demand for hospice care will continue to grow due to healthcare reform measures and the aging of baby boomers. We're expanding our inpatient hospice care by adding 12 patient rooms at our Texas Medical Center location. We're also increasing our capacity to care for individuals in the outlying communities by adding inpatient care in existing contracted facilities and home care in those areas. Houston-Hospice is uniquely positioned in the community because we're the oldest, largest, independent, community-based, community-supported, not-for-profit hospice serving the greater Houston area. More importantly, our physicians are specialists in hospice care, and our nurses are the top in their field. We're here for the entire family, offering a holistic approach and treating the family as a unit of care. Bereavement services are provided for up to 13 months after the loss of a loved one. Our service includes pediatric hospice care, called the Butterfly Program. The spirit of the Butterfly Program is, measure not the length of their days, but the grace of their flight. Houston-Hospice is effective because our pillars are customer service, quality, employee partnership, operational excellence, growth, and education. We recognize, understand, and teach all of our patients and families, physicians, referral sources, and our community. They're at the center of our attention and our decisions. We're focused on meeting their needs and exceeding their expectations. Houston-Hospice has a proactive management style, anticipating and acting rather than reacting. Care is provided by a multidisciplinary team working together along with the patient's primary physician to create a customized, all-encompassing plan. A team consists of a physician, chaplain, nurse, social worker, hospice aide, and volunteer. Houston-Hospice activities are tracked daily and compiled into annual statistics. Additionally, the Texas Department of Human Services, Medicare, and Medicaid conduct periodic evaluation surveys. Houston-Hospice is accredited by the Community Health Accreditation Program, which means that the organization has voluntarily met the highest standards of excellence for home and/or community-based health care. To effectively measure patient outcomes, Houston-Hospice uses data family satisfaction surveys and tracks such metrics as the resolution of pain, response times during non-business hours, falls, and other adverse events. The best measure of success is when the family tells us they couldn't have come through this without us. A common misperception is that hospice is a place. Rather, hospice care is based on the belief that each of us has the right to die pain-free and with dignity. Houston-Hospice serves most patients in the comfort of their own home. Hospice does not mean giving up hope. Hospice helps patients reclaim the spirit of life when facing life-limiting conditions. Our experience has taught us that hospice care may bring opportunities for reunion, laughter, and resolution. One major accomplishment has been the build-out of the third floor of the Margaret Cullen Marshall Hospice Care Center in the Texas Medical Center, providing 12 more patient rooms. Houston-Hospice has experienced unprecedented growth, meaning we're able to provide hospice care to more people in our community. We enjoy a reputation as the market leader for quality and service, as proven in the results of the family surveys conducted by an outside firm. Our results are favorable compared to state and national averages. Our biggest challenge is a shortage of qualified hospice employees. With the increase in the number of patients and families we care for, it's a challenge to keep up with staffing and stay ahead so that we don't give our nurses an overwhelming amount of patients. Our inpatient care is resource intensive. Any medical facility will tell you that the first and last days are the most intensive. This requires us to be on top of our game so that we're able to balance our care with fiscal responsibility. First, we'd hire additional employees so that we could provide more hospice care to those who want and need it. Second, we would expand our education services to broader populations. This includes the public as well as physicians and other medical personnel. And we would continue to add hospice inpatient care as well as home care in our 10-county service area. Houston is known for its diversity, and Houston-Hospice wants to become more aggressive in reaching out to the various cultures in our community. For example, in order to best serve our Spanish-speaking population, we need to create teams who are sensitive to the needs of those cultures.